This is test number 15, so we're going to do our physical exam on the dog. So we have our patient here, so Tammy's going to go ahead and walk her around so you can see. She looks a little overweight, so on a body score index I'd give her a 5. Her hair is a little long, so it does look like she needs to go to the groomer. Come on. Come on. There you go. She seems to be walking well, so now what we're going to do is go ahead and bring her up here and get a weight on our scale here. Oops. She seems to be generally laid back. Okay, so she is 10 pounds, 1 ounce. So we're going to go ahead and write that on our scrap paper so that we can put that into our record when we're all done. So now we're going to move that out of the way. Okay, so Tammy's going to provide proper restraint for us. So now we're going to go ahead and take a look at her gums. Gauge their color. So they are a nice pink, so they look good. We're going to go ahead and get our capillary refill time. We're just going to gently push and release and see how long it takes to return to color. So it's less than 3 seconds. So we're just going to put that on our sheet. And then we're going to go ahead, check her heart rate and get her sorry, we're going to use our timer and just start this as we don't have a stopwatch. Okay, so our heart rate is at 130, so we're going to mark that. And to determine our heart rate, what we do is we set our timer for 15 seconds and we count the number of beats that we receive, and then we times that by 4. So what we're also going to do is listen to her heart and feel her femoral pulse so that we can determine that we're getting a heartbeat and a pulse for each. Stand up. Okay, and so for every heartbeat that we have, we do have a pulse in the femoral pulse, so that's good. Okay, so now what we're going to do is observe her respiration, looking for any abnormalities, making sure that she's not breathing heavy, panting, shallow breaths, anything like that. She just seems sleepy today. So everything looks good. So we'll also keep an eye on that while we're doing the rest of our exam as well. So now we want to get our respiration, our respiratory rate. And to do that, we're going to set our clock for 15 seconds. And then we're just going to count the number of breaths that she takes in that 15 seconds and times that by 4. So her respiration rate is 24, so we're also going to go ahead and put that on here. Okay, and then we're going to go ahead and get her temperature. So we're just going to put a little bit of lube onto our gauze pad here. And then while Tammy holds her, we're going to go ahead and gently lift her tail. Insert that rectally. We don't have probes, so when we're all done, we will use our disinfectant to clean that off. So her temperature is kind of low. She's 94.6. So we're going to put that onto our slip of paper there. So now we're going to check her temperature. So we have some gauze on our pad here. So we're going to place that on the tip. And then while Tammy holds her for us, we're going to gently insert and get our temperature. And then since we don't have probes for these to cover them, we'll use our Provet Logic to clean it up when we're all done. Okay, so our temperature is 100.2, so that's good. So we're going to write that on our paper here. And then the next thing that we want to do is we're going to go ahead and start our physical exam. So we're going to start at her head. So we're going to go ahead and take a look down at her ears and see how they look. And we're looking for any excess wax or buildup in there that could be ear mites or infection. So her ears look good there. Let's get the other one. Okay, and that ear looks good too. So now we're going to go ahead and check her eyes. And we're looking for anything like clouding or cataracts that could be visible, any discoloration. So they do look good. So I want to go ahead and check her teeth, see how they look. So there is some tartar on there, so she could definitely benefit from a dental. Let's see this side, honey. Yep, and there is some tartar on those teeth as well. So then we want to feel her glands to make sure that they feel okay. And then go ahead and gently open her mouth too so that we can try to see clear into the back. Hey, sweetheart, I know. Want to make sure everything looks good. So it looks good in there. Okay, so now the next thing we're going to do, we're going to go ahead and palpate her prescapula, lymph nodes, make sure that they're okay. And then we're going to gently check her trachea. Okay, so that's good. And now what we're going to do is we're going to start at the top of her spine right here, and we're going to just gently apply pressure along her spine to see if there's any pain. We're going to go all the way back and do her neck and back all at once. Okay, and she seems to be okay. So then we're going to go ahead and check over her coat, looking for any lesions or ticks or anything like that. Make sure we're not missing anything. Check the tail. Maybe a little bit of dandruff, but other than that, there's no lesions, no cuts, no scrapes, and no parasites that we need to be concerned with. Okay, so the next thing we're going to do is go ahead and osculate her heart and make sure that we don't have any heart murmurs. Her heart sounds good, so we don't have any murmurs. So now we're going to go ahead and listen to her lungs and make sure that they're clear. so her lungs sound clear, so that's wonderful news. So now we're going to go ahead and just, while Tammy holds, gently palpate her belly to see if she's painful or if we feel any abnormalities. So we're actually feeling her liver, her kidneys, and we're actually trying to see if there's any masses or tumors in there, and everything feels really good there. So now the next thing we want to do is we're going to go ahead and we're going to check back here to make sure everything looks good. We want to make sure that the anus is good and that there is no discharge or anything from the vulva. Okay, so everything looks good back there. So the next thing we want to do is check the lymph nodes back here and make sure that they all feel normal. Okay, then we're going to go ahead and gently check her range of motion. I know, sweetie. Check the bottom of her paw pads. In between her toes. Okay, so that one looks good. I know, sweetie. That's okay. I know. Let's see. I know. Let's check and see. So she looks good. No cuts, no scrapes. Let's check your front ones, baby. And one more, sweetie. I know. Okay, so everything looks good there. So now we're going to take our scratch paper with our information on it, and we are going to come over to the computer and we're going to put our information in. So and this way the doctor will know everything that we've seen today and can compare it to hers. Okay, and then if we had any other notes, like any concerns, we would go ahead and put them under other so that the doctor could review those. And then that is task number 15, our exam for our dog.